watery eyes, sneezing. Those are all signs of spring. With the arrival of this wonderful warm weather that Stacey Ann has been telling us about, allergy season strikes big. The next couple of days, allergy sufferers should expect high pollen levels or higher pollen levels. So more on what to know and how to cope. Dr. Payel Gupta is here, and she's an allergy specialist working on the Upper West Side. First of all, thanks for coming in at this early hour.
Thank you for having me.
And now that the warm weather, just these past couple days, we could really feel it. People who suffer from allergies, this is the worst time of year for them. What are your patients telling you? Are you booked solid?
I am booked solid, and it's been already a pretty rough allergy season for people. People are coming in with those itchy eyes, runny noses, and even asthma symptoms for people that have allergic asthma.
When you say it's already a pretty busy season, is it coming earlier than it has in years past for you?
Well, in general, with global warming, we are seeing an earlier spring. And so, with increased temperatures and increased CO2 levels, that's all been attributed to an early spring and higher pollen counts.
And is it really just the spring, or does that carry over into the summer? Is it a longer season in general?
Longer season in general. Yeah.
And so what are some of the things that people can do? I mean, is it just that you go out and you buy your Claritin, or I know I'm allergic to bees. It's not an allergy, but I go and get venom shots, and that helps.
Yeah.
And I often see people who suffer from pollen allergies there.
Yes.
Is that something that you advise, or does it depend on the patient?
Yeah, I mean, allergy shots, as you know, because you're getting venom immunotherapy, are a big deal. You have to come in weekly for a period of time, and then it goes to monthly. So allergy shots are great because they really do help reduce symptoms, and they can help for people who have allergies that are pretty moderate to severe.
But as you point out, it's so time-consuming to go to the appointment, to sit there. What are some of the easier, effective options, or does it really mean you need to stay indoors as much as possible?
No, I mean, I always say people with allergies shouldn't limit themselves. We should not keep our windows open during pollen season, because that's going to bring the outdoors inside, and that's something that we definitely don't want to do. But, going in and getting treatment options early on is the best thing. So don't wait until you're at the height of your symptoms to finally seek help, because at that point we have to use stronger medications, and it takes longer to kind of resolve those symptoms that you're having.
Is allergy season different in New York City versus, say, the suburbs or the countryside somewhere?
Not necessarily. I mean, pollen in general travels 50 miles or more. And so we have Central Park, other places have trees everywhere. So pollen is kind of ubiquitous. And like I said, in general, we are all experiencing warmer temperatures. And, the State of Air report was just released by the American Lung Association today, actually, their 20th year of releasing this report. And it shows that 2015, 2016, and 2017 were the warmest years globally that we've ever seen. And so that's just showing you that temperatures are rising, and all those temperatures are going to affect the pollen seasons, as we discussed.
And does that make more people allergy sufferers who might not be?
Yes. Definitely. I've been seeing that in my office, people who have never experienced allergies, and specifically in the last 2 to 3 years, they've been feeling their symptoms more.
Okay, Dr. Payel Gupta, thanks for coming in
Thank
this
you
morning.
for having
We appreciate
me.
it.